Hi, I'm Dr. Seth Waldman. I'm an interventional pain management specialist at the Hospital for Special Surgery, and I see patients primarily with spinal pain. Spinal problems are almost universal. At some point, everyone has an experience with back pain or sciatica, and it can become very frightening and disorienting, not only to realize that we're all more fragile than we think, but to not be able to do the things you normally do, not be able to work, not be able to exercise, not be able to take care of your family, sometimes not be able to rest. When possible, I want to get everyone back to doing the things that they enjoy as soon as possible, whether that's sports or picking up a grandchild. I'm the team pain management physician for the New York Giants and a former marathon runner, so I get the commitment to high-intensity exercise and sports. I dropped out of my first marathon with a stress fracture. We need the right help at the right time to recover. Sometimes once we recover, the most important thing is to try to understand how the injury occurred in the first place and then use that wisdom to develop an exercise regimen that makes it less likely to happen again in the future. What excites me most about my work is the opportunity to see people sometimes at their worst, to help them understand what the problem is, whether that's by listening to their story, by doing a physical examination, reviewing imaging studies, to develop an intervention plan to get them better and back to the things they love as quickly as possible, and most importantly, to try to develop a plan going forward to minimize the chances that they're going to have another recurrence in the future. Generally, when I see patients for the first visit, we'll spend about an hour together reviewing their history, reviewing physical examination, reviewing their imaging studies, and try to come up with an understanding of what the problem is. I want to understand their expectations for treatment, how that's going to impact their life, and what their ultimate goal is. I find that patients begin to improve sometimes almost immediately once they begin to take action with the problem. For me, it's more important to understand what sort of a person has the illness rather than just understanding the illness itself. It's important to me to make sure that the patient gets the right treatment first, and I think that where you get treated and how you get treated first makes a difference in the outcome, whether the problem is simple or more complicated. The most magical part is when you see a result sometimes that you didn't necessarily expect, when somebody internalizes a message that you might give 1,000 times, but they take it past even where you thought your expectations would be, in terms of exercise, in terms of reconditioning somebody who's become very deconditioned, in terms of trying to get people off of medications that they may have been dependent on, or doing exercises that they weren't able to do before. That's the goal of all this, to see people go back not only to where they were before, but maybe even if they can get better than they were before.